Welcome to day 1 of your CPC exam 2025 preparation. In this session, we'll dive into the structure and format of the Captain Manual, an essential tool every coder must master. Let's get started. The CPT Manual is divided into 6 main sections, ranging from evaluation and management to medicine. Codes are grouped by medical specialty and services. Categories 2 and 3 cover tracking and emerging technology codes. Each CPT code has 5 digits. Category I includes the regular codes. Category 2 codes track performance. Category 3 codes are temporary and often used for new technologies or experimental procedures. Symbols in the CPT manual highlight important updates. A solid circle means it's a new code. A triangle means the code has been revised. A plus sign indicates an add-on code, and so on. Understanding these symbols helps you avoid coding errors. CPT codes include a description of the procedure or service. Some also include time components or patient status. For example, code 99213 refers to an established patient office visit lasting 15 to 29 minutes. The CPT index is your starting point, arranged alphabetically. Search by procedure, organ, or condition. But remember, never code directly from the index. Always verify the full description in the main section. Let's practice. Use your CPT manual to find code 99214. Check which section it belongs to, the time element, and whether it allows modifiers like 25. Also, is the code new or revised? This kind of task builds confidence for the exam. To summarize, the CPT manual is well structured into defined sections. Symbols and format help coders identify important details. And remember, verify every code in its full context. You're now ready to move to the next day. Welcome back to day 2 of the CPC exam preparation series by KS Medical Coding Academy. In today's session, we're diving into one of the most important foundations in medical coding, the CPT Guidelines. CPT Guidelines are official instructions provided by the American Medical Association. These guidelines are placed before each major section and help coders understand how to use the codes correctly. Whether you're coding an EM visit or a complex surgery, guidelines are your go-to roadmap. Why do guidelines matter? They provide clarity. They tell you what's included in a code, when to use modifiers, and how to avoid coding errors. In other words, guidelines are the rulebook behind each CPT code. You'll find Captain Guidelines in 3 main places. General Guidelines at the beginning of the book. Section Guidelines, like those before the radiology or surgery chapters. Subsection Guidelines, such as those for the musculoskeletal system. Before coding any section, always read these. Guidelines often include code range definitions, terminology explanations, modifier usage, instructions for multiple procedures, reporting rules for unlisted procedures. Understanding these topics can help you avoid the most common mistakes. Take the surgery section, for example. The guidelines here explain how procedures are bundled, define global periods, and when to apply modifiers like 51 or 59. Without these, choosing the correct surgical code becomes a guessing game. For the CPC exam, here's a tip. Always read the section or subsection guideline before coding a question. Underline or tab key instructions during your prep, especially if your book allows marking. These guidelines can be the difference between the right and wrong code. A quick refresh from day 1. Red circle new code. Record button revised code. Prohibited deleted code. Plus add-on code. Cross mark modifier exempt. These symbols work alongside the guidelines to guide your selection. To succeed in the exam, never ignore guidelines. Mark your book strategically. Practice mock tests with guideline-based questions. The CPC exam is open book, but only if you've studied what's inside it. Let's wrap up day 2. CPT guidelines are essential for accurate coding. They appear before each section and must be reviewed. Your task today: go through the guidelines for EM and surgery sections in your Captain Manual. Memo comment below once you've done it. Welcome to day 3 of our CPC exam preparation series. brought to you by KS Medical Coding Academy. Today, we'll explore the important symbols and conventions used in the Captain Manual, a must-know topic for every CPC candidate. The Captain book isn't just about codes, it also includes special symbols and formatting conventions. These visual markers tell you what's new, what's changed, what not to combine, and so much more. Learning these symbols now will help you save time and avoid mistakes in the CPC exam. Here are the main symbols you'll find in the Captain Manual. A black dot, filled circle, means the code is new this year. A triangle, filled up pointing triangle, indicates the code or its description has been revised. A strike through cross, multiply, means the code has been deleted. A plus sign, plus, shows it's an add-on code, it must be used with a parent code. The lightning bolt, high voltage, means the procedure is awaiting FDA approval. A circle, hollow circle, means the code is modifier 51 exempt. And the star marks codes that are approved for telemedicine. When you see a black dot next to a code, it means it's a brand new code added this year. So always check the description carefully. A triangle symbol means that something about the code has changed. It could be the wording, numbers, or instructions. Don't assume it's the same as last year. If a code is marked with a strike through or multiply, it has been deleted from the Captain Manual. You'll usually find a reference pointing to the replacement code. Add-on codes, marked with a plus sign, plus, cannot be used by themselves. They must be reported along with a primary procedure. These are always indented and describe additional services. A circle symbol, hollow circle, means the code is modifier 51 exempt. That means you do not report modifier 51, even if it's performed with other procedures. The star symbol shows that a service is approved for real-time telemedicine, a feature growing more important in today's healthcare landscape. Another unique Captain convention is the semicolon. You'll often see a main code followed by indented codes. These are shorthand. The full procedure description is split, the part before the semicolon is shared, and the part after is what makes each code unique. Let's look at this example. 10,021. Fine needle aspiration, without imaging guidance. 10,022, with imaging guidance. This structure avoids repeating the full description. Throughout the CPT book, you'll see instructions like, use in conjunction with, do not report with. See also, these notes are extremely important for proper code usage, especially when reporting multiple procedures. Always read the fine print. For the CPC exam, questions will often test whether you understand these symbols and conventions. Practice identifying symbols in mock questions. You can also color code or tab symbol definitions in your CPT manual. Just make sure it follows AAPC's exam rules. Let's wrap up. Symbols like filled circle, filled up pointing triangle, multiply, and plus help you quickly understand changes in code relationships. Semicolons and indentation show you how to read code descriptions. Instructional notes tell you what to combine, and what not to. Books today's homework. Go to the first 10 codes in each major section of your Captain book. Identify the symbols next to them, and write down what each symbol means and how it affects the code. Welcome to Day 4 of the CPC Exam Prep Series from KS Medical Coding Academy. Today's topic is how to properly use the Captain Index and follow the right steps to select the correct code, an essential skill for success on the CPC exam and in real-world medical coding. The Captain Index is found at the back of your Captain Manual. It's the starting point for locating codes, not a final answer. Just like the index in a textbook, it helps you find where a code may be located, based on keywords, anatomy, procedures, or conditions. The index is organized alphabetically and includes main terms, like repair, fracture, or excision. Subterms, that provide more detail. Cross-references, such as see also, or see. Each main term can lead to multiple code ranges, which must be verified in the main sections of the Captain book. Let's walk through an example. Suppose you're coding an excision of a lipoma on the arm. Start by going to the index and looking for excision. Then find soft tissue tumor, and finally arm. You might be directed to codes like 24071, 24079. Now flip to that code range in the main section to verify the correct code based on size and depth. Remember, the index is just the starting point. Never code directly from the index. Once you find a code range, you must go to the main section, read the full descriptions, and apply any applicable guidelines, instructions, and parenthetical notes. Let's break down the proper CPT coding process into clear steps. Keycap 1, identify the procedure or service. Keycap 2, locate the main term in the CPT index. Keycap 3, follow subterms to narrow it down. Keycap 4, note the code ranges provided. Keycap 5, flip to the main section in CPT. Keycap 6, read all code descriptions and guidelines. Keycap 7, apply any applicable modifiers. Keycap 8, select the most accurate code based on documentation. Here are some common index main terms used in the CPT. Procedure names: biopsy, repair, incision, aspiration. Anatomical sites: eye, skin, liver, elbow. Conditions: tumor, fracture, abscess. You can even use synonyms, like searching drainage, instead of aspiration. CPT often includes cross-references. During the CPC exam, speed matters. Checkmark, practice locating keywords quickly. Checkmark, be careful with similar terms. Excision versus incision. Checkmark, mark the index section in your book with tabs. Checkmark, don't waste time searching if the answer clearly lies in a given section. Trust your preparation. Watch out for these mistakes. Crossmark, coding directly from the index. Crossmark, skipping guidelines. Crossmark, confusing similar terms. Crossmark, overlooking parenthetical notes. These small errors can lead to big point losses on the CPC exam. Let's recap today's key points. The CPT index helps you find code ranges. Never code directly from the index. Follow a systematic process for selecting codes. Practice navigating from the index to the main section. Book homework. Pick 5 random procedures, like excision of cyst, drainage of abscess, removal of toenail, etc. Use the CPT index to find the code ranges, and then verify the correct code from the main section. Welcome to Day 5 of the CPC Exam Prep Series with KS Medical Coding Academy. Today's session focuses on practice scenarios and CPT book navigation, 2 skills that are key to finishing your exam on time and scoring high. Even though the CPC exam is open book, it's also timed. That means you must be quick and confident in navigating your CPT manual. Practicing real-world scenarios improves your speed, helps you apply guidelines, and prepares you for the actual test conditions. Here are some tips to improve navigation. Use colored tabs to separate major sections like E, M, surgery, and radiology. Highlight important guidelines at the beginning of each section. Underline or mark symbols, unlisted code notes, and modifier instructions. These simple steps make it easier to find what you need, fast. Let's build muscle memory with 5 fast drills. Set a timer for each. Find a new patient office visit code. Locate a code for arthroscopic knee surgery. Search for a CT of the abdomen with contrast. Look up excision of a 2 cm benign skin lesion. Identify an unlisted procedure for the musculoskeletal system. If you can find each in under a minute, you're exam ready. Scenario 1. A provider excises a 2.1 cm benign lesion from the left cheek. Head to the index and look under. Excision, right pointing arrow, lesion, right pointing arrow, skin, right pointing arrow, benign. Locate the size-based codes and flip to the integumentary section. You'll find 11,442 excision, benign lesion, face, 1.1 to 2.0 centimeters. Scenario 2. A 35-year-old patient is seen for diabetes follow-up. The provider performs an expanded problem-focused exam and moderate MDM. Go to the E/M section, under Office or other outpatient services, then find the established patient codes. Based on MDM, the correct code is 99,214. Scenario 3. A CT scan of the abdomen and pelvis with contrast is performed. Use the index. CT right pointing arrow abdomen and pelvis right pointing arrow with contrast. Then verify in the radiology section. You'll find 74,177 CT, abdomen and pelvis, with contrast. Scenario 3. A CT scan of the abdomen and pelvis with contrast is performed. Use the index, CT right pointing arrow abdomen and pelvis right pointing arrow with contrast. Then verify in the radiology section. You'll find 74,177 CT, abdomen and pelvis, with contrast. Avoid these common mistakes. Cross-mark coding directly from the index. Cross-mark skipping section guidelines. Cross-mark confusing similar terms like excision versus destruction. Cross-mark ignoring add-on and unlisted code instructions. Your Captain book is full of clues. Make sure to read them. To recap, practice improves speed, and speed increases confidence. Use your Captain manual actively, not passively. Realistic practice scenarios are the best way to prepare. Book today's homework. Complete 5 timed practice scenarios using your Captain book. Write down the code you selected and how long it took. Repeat tomorrow and try to beat your time. Thanks for joining day 5 of our CPC study plan. If this helped, like this video and subscribe to KS Medical Coding Academy. Tomorrow in day 6, we begin a new section, Evaluation and Management Coding, step-by-step walkthrough of code levels and categories. See you there.